So I guess we should open things up for question and answers.
Thank you, Brad. You did a great job moderating, and hats off to all of the speakers. It is rare in an ADAO conference that we have one extra minute, and believe it or not, we can spend 10 minutes on Q&A. So we have a few that have come in from just the agenda. So let's start with a little bit of a conversation, as Anna talks about having some of our conversation, not only about difficult issues, but let's talk about what we can move forward. Arthur, what I hear from colleagues is what happens in the US matters abroad. Can you touch on our policy and how it impacts Asia and some of the other countries that you work in?
Yes, as I commented a bit earlier, even though the United States is no longer the leading light, if you will, for occupational safety and health, that's sort of been claimed by some of our European and Scandinavian colleagues. America is still considered an important place to look to. And when other countries see that we have not banned it, the simple refrain is, if you haven't done it, why should we do it? And it would help a great deal to get beyond the 70 around the world if the United States would now also ban asbestos. And that, I think, will bring many, many other countries on board about this.
I agree with you. Dr. Lemon, I have a question for you. You have a very distinguished career with NIOSH. You understand how agencies think and move. Can you share a little bit to our viewers about how distinctly different the jurisdictions are? Like, many people ask us if with our ban bill, would FDA be able to ban talc under our ban bill? Let's talk about the jurisdictions for FDA, NIOSH, and EPA, if you can bundle that up easily. I think that would help some of our listeners.
Well, Linda, I'll try. It's sometimes even difficult for us to understand the jurisdictions, but OSHA was formed at the same time that the National Institute for Occupational Safety and Health was formed, with a bill in Congress in 1970. So we're fairly young organization, even though we're turning 50 years old today, which is hard to believe because I was there when we began. And so it's what we have at NIOSH is a research agency. We research the diseases that affect workers and their families. What we have at OSHA is an enforcement agency that takes our research and research from others in the academic community and put it into regulations to protect workers. Now, the Food and Drug Administration, the FDA, has authority over drugs. It has authority over some devices, such as radiation devices, emitting devices, etc. And that is their jurisdiction. The Consumer Product Protection Agency, which is another agency you may or may not have heard of, has the authority to protect consumers. So they come into the asbestos picture and dealing with products that contain asbestos. And as you know, we've seen many of those products, and ADAO has highlighted that in crayons, in a detective kit made in China, and many other products. So the jurisdictions are somewhat confusing to those that don't work in the federal government. So I hope I've given you some idea that these agencies do, in fact, work together. When I was with NIOSH, we set up a committee called ONE. It was the OSHA, NIOSH, EPA committee. And we met regularly to deal with issues, not only asbestos, but other issues that we all had common interest in. So the government does have mechanisms to work together. I think that committee is still going forward in regular communication between the agencies. And together, we hope we're able to ban asbestos after asbestos is banned, to take it and continue our work to further take steps as under our jurisdiction to deal with asbestos? That's a long answer. I'm sorry.
No, I think it's very important because it's complicated. So maybe, Richard, what we'll do is we'll write up a blog with Arthur and Brad and others, and we will differentiate the jurisdictions because there is confusion. And sometimes that confusion is used to oppose our ban. And I know it's hard to share stories. I've been sharing Alan's for 17 years. I teared up at the kitchen table this morning. Those conversations are hard. Alan never wanted to know what was happening. Can you share? You're a very strong woman, and I know your sisters. Is there any advice that you gave your mom for how she could, how her journey, her treatment journey, and her ultimately her end of life journey? Because I think those conversations are hard. What did you and your sister do? Because I think you could probably help another conference attendee this morning.
Sure, Linda. And that's a great and hard question. And if something I say does help someone, that would be great. But the truth is, it's really hard and it's really different for everyone. I think that one of the most important things to do as somebody who is sort of an outsider is, even though it might be your loved one, your very close loved one, you are ultimately an outsider to what is going on for that person. The most important thing is to really meet them where they are in the process. And so if the person says to you that they're just not ready to have a particular conversation at a certain point in time, to not fight that, and to kind of let things play out a little bit for them. But it is also important to try to find a time when they may be more open to having a conversation. So sometimes it might be, immediately before a doctor's appointment, where you can say, preface it with, well, we're going to go into this appointment. Let's talk about the questions that we have, and really gear those toward what kind of treatment they're looking for. And then other times it might be just when you're, out and about, or just at home, spending some time together. And really trying to find a time where you can balance between giving them the positivity and the hope that you want them to have and that you feel, but also to encourage them to think about some of the harder things that are going on, which of course is hard in and of itself, because it means you yourself have to be confronting those difficult things. And so it's multi-layered in terms of difficulty, but to the degree that we can all really try to focus on putting ourselves in the shoes of the person who's going through what they're going through, as difficult as that is. I think that's really a way to try to have those conversations, and also to encourage them to talk to other people. So it may be, I think in my case, my mom didn't want to feel like she was burdening my sister and me with the concerns that she was having and the fears that she had. And so, if they have a close friend or spouse to whom they feel like they want to talk about, or a therapist, or even just a neighbor who maybe has had a similar life experience, to really encourage them to have those conversations, and then to not pry into those and let that be their space. So hopefully those are all ideas that could help someone.
I think so. I see Dr. Frank wants to share. Dr. Frank, you're muted.
Thank you, Linda. I just wanted to add a bit to that. One of the things that I do, and I've been doing it for over 40 years, is have been engaged in the world of medical legal evaluations. I've been looking at hundreds, in fact, over the years, thousands and thousands of charts of asbestos victims that have come to my attention from attorneys. Doing this, I've seen that every penny of fees that I might otherwise have been paid have gone to my universities, but I'm there to try to help people. That's another part of the conversation that is often difficult to have. Yet families have suffered very often financially, as much as insurance may pay for some things, it doesn't always cover all the costs, and that some folks, that say, look, I worked for this company for years. They did well by me, but so I don't want to sue. I think that those can be difficult conversations sometimes, and people need to think not so much for themselves, but for the families that are left. That nobody would rather have the money than the person, but it does help and balances the cost that sometimes comes with the care that insurance won't completely cover, and it pays for some of the true emotional costs that people go through to deal with these kinds of issues.
No, those are important points. Earl, I have a question for you. Brad, you're going to be in session 2. I'd like to make a suggestion that you and your colleagues carry on the conversation about how we talk about end of life or meet a patient where they are, because for us as families, and I know you're very sensitive, Dr. Black, from being in Libby, Montana, is that we as patients and family members have a difficult time talking about these things. Alan always said he would never be ready for hospice, and he never engaged in hospice. I might have been, but he was terrified. And I think there is a terror about dying. And Alan's comment was always, I want to die with dignity. So we had a hospice doctor scheduled to speak in session 2, and unfortunately couldn't join us, but I think we should be bold enough and brave enough to carry on the fact that our physicians should be able to guide us with good information and facilitate those conversations, because it is hard for everyone. Ann and I could probably burst out in tears. So I'd like to carry that over, Dr. Black. Earl, my dear friend Earl, he has trudged around that camera all over. And if you look at that smile, the guy's heart is just as fabulous as that smile. Earl, we've worked together since 2015 through the ups and the downs. You have photographed conferences, briefings, marches, the Bracey's family. We've driven all over the country together. This is a hard question. You're an award-winning photojournalist, and you are my dear friend. So I love you. There's no wrong answer. Over the course of the last 6 years, do you have 3 of your photographs that you might have featured in your poster, or something you didn't, that you just want to touch on? Because not only is the photograph amazing, but that moment is amazing. Share, please.
Thank you, Linda. As the visual guy in this group, think of the Matt Mullers and Riley's first birthday. My wife Deborah and I were able to share a celebratory moment with them as their daughter had her first birthday. It was a good time. It was a happy time, and it was a personal time. And so I encourage every one of you to, with your cell phones, really enable film clips and opportunities for still photos to document those intimate moments. We don't have our bicycles from one coast to the other to what Zach Johnson and Connor Lewis did in Dirty Laundry, but we can begin to record these moments that will be precious to you and that you can choose to share with everyone else at ADAO. Thank you, Linda.
No, that's a beautiful. I was staring over my family, the pictures of Alan with Emily that we had done. Who knew back then that those would become some of my most treasured memories? So you're right, Earl. And thank you for walking alongside of us, leading us and listening, because that's huge. Okay, Dr. Brad Black, before you jump off, I got a question for you. You're from Libby. I think I want to move there where there's blue sky and clear airs. Tell me a little bit on the personal side of being in Libby. You've known Les Scramstead and some of the mesothelioma warriors and warriors in general. When those crosses go up in the graveyard, when I went there years ago, that was an astounding visual for me to see and feel that personally. What do you do with your patients at the card clinic? How do you best help them work through their possible anger, fear, and anticipatory grief? I know that's kind of a loaded question as a physician, but I bet you can answer it.
Well, I I've learned through time as a clinician and a physician and a person that's a friend of the family, which is always hard to balance because objectivity is key in our work. But I've found that there may be very few things we can do, and many physicians are uncomfortable with that and tend not to engage with that. The patients, after there's really nothing they can do, when in fact that's when they really need you, is when there's nothing left to do. They need you. They need that support. It gives them confidence. It makes their days better. And when you do that, it's just, it's amazing. And you don't realize the power you have to help a family when you think you're not helping them. And I've learned that over time. And I got to tell you, as you know, I've been in Libby since 1977. I know virtually everybody in the community, and they know me. And I know what they've been through, a very unfair situation here. And we all missed it. And now we're trying to make up for what happened. And it's all about why bands are important, because by the time you see this disease, it's too late. And so the least we can do for our patients is to be there for them and to help them through the disease processes that we can't do anything about for the most part. But that's not true, because there's many things we can do to make their disease much different than it ends up being. So yeah, you have to remember that as a care provider. I think that's something that has been, a lot of physicians never get that opportunity. And unfortunately in Libby, I did. And with the repetitive situations with patients dying of asbestos disease, an example, you'll have a family, father dies of asbestosis, the mother dies of mesothelioma, and now I'm taking care of their son who is in his mid-60s and has advanced asbestos disease. These are family histories in Libby. So you have to get in with the families and work through it. They've endured it once, they've endured it twice, and 3 times. This is how it happens in Libby because of the pervasive exposure to so many people. And of course, it's just, those are hard things as a physician, but you've got to hang in there because you realize you are helping them when you're not sure you are. So
you have a very gentle style, Dr. Black. I'm sure that you bring great comfort and information. It's going to wrap up, but Earl, I failed to say that you have 6 posts. Is it 5 or 6? I'm getting old now. 6 posters?
It's
5? 5. So
5 posters right now.
Let's make sure people know before we wrap up the conference how they could purchase one or the entire suite of 5 photographs, because your work is really beautiful and important. Brad, I'm going to stop talking. It's all yours to close. My thanks to all of you, because we kind of fly by the seat of our pants every now and again, and you guys were remarkable, as I knew you would be. Thank you. Brad, it's all yours.
Well, you didn't tell me I had this time to talk, but you did mention something about some letters from Senator Daines and Tester. Is this a time that we might introduce that, or what did you plan on there, Linda?
Yeah, I just wanted you to know we actually held the program to get both of your senators to have letters, and I sent them to Dr. Markowitz, since I know it's a little hard to read, but I just think the community that you have built in Libby, you suffered greatly. You now have, it's not new, but they've been stalwart champions, and I think having your senators engaged as they have been about asbestos awareness and prevention. Libby is unfortunately a tragic example. And I just wanted you to know that your senators stepped up really because of you, Brad. People love and respect you. And there are 2 letters supporting the work that you and collectively everyone have done here.